Niacin, also known as vitamin B3, is a bit of a nutritional celebrity with a dark side. On the one hand, it lowers LDL cholesterol, raises HDL, and has been hailed as a cardioprotective powerhouse for decades. On the other hand, it has a pesky habit of raising blood glucose levels in certain people, and not just a little. For populations already flirting with metabolic dysfunction, high-dose niacin may be less of a vitamin and more of an uninvited metabolic curveball. So, what gives? Can a vitamin really increase your risk of diabetes? As it turns out, yes, and the data isn't exactly subtle about it. Let's start with what's been observed in large clinical trials. In studies like the Coronary Drug Project, AIM-HI, and HBS2, Thrive, participants taking pharmacological doses of niacin, often 1,000 to 2,000 milligrams per day, showed statistically significant increases in fasting glucose, insulin resistance, and even new-onset diabetes diagnoses, especially among those with pre-existing risk factors. In the HBS2, Thrive trial, the risk of developing diabetes increased by around 32% in participants receiving extended-release niacin laropipirant. That's not a mild uptick. That's your pancreas ringing the alarm bell. Mechanistically, niacin-induced insulin resistance seems to stem from a few overlapping effects. First, niacin can cause increased hepatic glucose production by stimulating pathways that make the liver pump out more sugar into the bloodstream, right when you'd rather it didn't. It also appears to inhibit adiponectin, a hormone that enhances insulin sensitivity and supports glucose regulation. So you get more glucose entering circulation, and the body becomes less equipped to handle it. That's a metabolic double whammy. Another twist: high doses of niacin may promote lipolysis, releasing free fatty acids into the bloodstream. That sounds like a great idea if you're trying to burn fat, but it's metabolically problematic in people with insulin resistance. Elevated free fatty acids compete with glucose for energy metabolism and may impair insulin signaling, leading to further dysfunction at the cellular level. So while your lipid panel might look shinier, your glucose metabolism could be slowly unraveling in the background. Now, let's not throw the niacin bottle into the garbage bin just yet. The diabetogenic risk seems to be dose-dependent and context-specific. Lower doses, such as those found in multivitamins or from food sources, do not appear to have the same detrimental effect. In fact, niacin is essential for NAD+ synthesis, mitochondrial function, and energy metabolism. The body needs it, but as with many nutrients, more is not better, especially when you already have impaired glucose handling. People with metabolic syndrome, prediabetes, or a strong family history of type 2 diabetes are likely more sensitive to niacin's glucose-raising effects. In these individuals, the cost-benefit ratio of high-dose niacin supplementation gets murky. It may improve lipids, sure, but at the expense of glycemic control, which is arguably a more powerful predictor of long-term cardiovascular and all-cause mortality. And let's be honest, nobody wants to trade lower cholesterol for a diabetes diagnosis. Interestingly, genetic studies suggest that variations in niacin receptor expression, such as GPR109A, and differences in NAD+ metabolism may make some people more vulnerable to niacin-induced side effects than others. This opens the door to personalized niacin therapy, where we don't hand out megadoses like candy but instead tailor doses based on genetic risk, metabolic biomarkers, and maybe even gut microbiome profiles. Speaking of which, there's emerging evidence that niacin interacts with the gut microbiota, and the degree of this interaction could influence insulin sensitivity. Certain gut microbes can metabolize niacin into potentially pro-inflammatory byproducts like 2-PY and 4-PY, which have been linked to insulin resistance and vascular damage. The more we learn about these metabolites, the more we realize that high-dose niacin isn't just passively absorbed, it's actively reshaped by the gut-liver axis. In short, the idea that niacin is always heart-healthy is no longer metabolically sound. Yes, it can improve lipid profiles. Yes, it's an essential vitamin. But high-dose niacin supplementation, particularly in those with pre-existing glucose regulation issues, poses a real risk for worsening insulin resistance and tipping people into full-blown diabetes. The U-shaped curve rears its head again. Too little niacin is dangerous, but too much isn't necessarily medicinal. So, what's the takeaway for the average person navigating cholesterol, blood sugar, and the vitamin aisle? If you're metabolically healthy and your doctor recommends niacin as part of a lipid-lowering strategy, fine, but monitor your glucose levels. If you're already insulin resistant, have prediabetes, or enjoy tracking your HbA1c more than your step count, you may want to focus on dietary niacin from whole foods like meats, fish, mushrooms, and peanuts, while addressing lipids through lifestyle, omega-3s, and other nutraceuticals with gentler metabolic footprints. Because at the end of the day, no one wants to lower their cholesterol just to end up swapping it for a prescription for metformin.